treating Lyme. Treating Lyme has been an incredible process for me. It looks like the CDC and the IDSA are changing their views and starting to listen to people that are sick with Lyme. Used to be a month of antibiotics was sufficient, and that was all you were prescribed. And anything that happened after that month of antibiotics, as far as pain, arthritis, symptoms coming back, well, that was just post-treatment Lyme disease syndrome. And they're starting to realize that chronic Lyme is probably the worst name for it, because it's just an acute infection that left untreated turned into what they're calling chronic Lyme. The IDSA, again, suggests that a month of antibiotics, doxycycline at 100 milligrams twice a day, is sufficient enough to kill this disease. But I see that they're changing things. This is new. I didn't see this a year ago. They're asking people that are sick to chime in with their regards on this situation. Connecticut's legislation, I believe it's Blumenthal, started it before 2015. And it looks like this guy, James Orlando, is carrying it on, but passing more bills to spread awareness, schools, education, a task force to study and perhaps maybe eradicate ticks carrying the disease, or, efforts being made. Probably things we should mirror. I know that I can't find the article, but I know that Blumenthal took on the insurance companies and changed it so that patients could get insurance to cover them. Like the VA stopped giving me doxycycline after a month because of the IDSA's guidelines, when in fact I needed much more doxycycline than 30 days at 200 milligrams a day. After that month, I went back to my doctor because my symptoms were returning so bad. I was so ill. He prescribed me more. I started to realize I was really only scratching the surface. I took it upon myself to up the dosage, and he, my doctor, wrote me a script that I could go pay for them myself and go to the pharmacy out on the economy. Did that for a couple of months, and I was herxing, which the next video I'll cover Herxheimer reaction, and decided to incorporate Flagyl, and really was pushing myself, clearing this out of my system. What I'm coming to find out after a year of this is I started researching garlic, and I found this gentleman on YouTube, the LA Beast. And he's a competitive eater, and one thing he was pushing himself to do was eat raw garlic as a challenge, and witnessing this reaction.
Okay.
Well, it
I gotta go to the
to
hospital, dude. I gotta go to the hospital. I can't. I gotta go
garlic
to the hospital,
for,
dude.
The chemical reaction that happened in him proved to me that garlic is more than just something you throw in tomato sauce to make it taste good. That research led me to this man, Dr. Cass Ingrams, claims that he's had Lyme 3 times, including cardiac Lyme, or Lyme associated with the vascular system. Claims that he killed it with oil of oregano and raw garlic, raw cold pressed hemp oil. You can get all that stuff at like Whole Foods or Natural Grocers or any health food store, really. Pretty interesting stuff that I did not believe and didn't even consider until after I started to realize that antibiotics weren't working, and I kept chasing my tail and ending up back in the same place. This guy, Richard Horowitz, he's from Hyde Park, New York. I believe he's part of the task force that the IDSA and the CDC or Connecticut was talking about. He's from New York, and he's been working with Lyme disease for a pretty long time. And he's working with the American government, senators in Congress and such, trying to enlighten them of what's really going on and what it takes to kill this disease. He seems to be a firm believer in antibiotic protocols, and that's fine. I'm not saying anything against antibiotics. I'm still taking them in a lower dose. Apparently it's safer to take them in longer courses than shorter courses, so I want to finish out a course before I completely get off of them. But there's the oil of oregano that I have. I got that at Natural Grocers. It was like 15 bucks. And the first thing I noticed it did was relieve sinus pressure and inflammation. Chronic sinusitis all the time. Headache, it helped relieve headache pressure, and it helped with joint pain, arthritis. It's an antibiotic, antimicrobial. It's got anti-inflammatory properties. I'm finding I don't need my anti-inflammatories, baclofen, from the doctor. The oil of oregano seems to be working for me. If I had known the power of these things in the beginning, I would most definitely have incorporated them from the start, and I would have considered a more natural approach than going with modern or Western methods. But that's all I've got for treating at the moment. I can definitely attest to the concept that a month of doxy, low dose, really didn't do much but just alleviate some of the symptoms and make life a little more tolerable at the time. It wasn't until I pushed myself to go higher doses and provoke die-off, which I'll get to in the next video. But thank you, and I sure hope that this video is getting better with time and critiquing. So any comments, feel free, please.